My name is Parag Kachalia, and I practice in San Ramon, California. So one expert tip I'd like to provide for you today is really the involvement of digital imaging. So digital imaging comes in many different forms, right? We have intraoral cameras, digital scanners, and then the latest component of digital imaging we introduced into our practice was cone beam CT. Now what's interesting is I'm a general dentist, I don't place implants, I do very little endodontic therapy, not a lot of extractions. So why does someone like me look at cone beam imaging? And someone like me looks at cone beam imaging because it provides an unbelievable data set of our patients. I don't necessarily take a cone beam CBCT on every single patient that walks in, but I do it when it's appropriate. I do it when it's appropriate to look at that next dimension of care for our patients, whether it's airway analysis, or whether there's an area they have root canal therapy, and we have a point where they're not healing, and it may be many years after the fact. And rather than going back and forth or taking many different periapical x-rays, I take a cone beam image of that area to figure out what's going on. That doesn't mean that I go in and I treat it, but I help on the diagnostic factors. So when I refer my patients back to the endodontist, or back to the oral surgeon, or back to the periodontist, there's a comprehensive care approach to see what's happening. And we share that data set back and forth. We always used to think cone beam imaging is just for the specialist. I don't think that's true anymore. Cone beam imaging is what panoramic imaging may have been 25 or 30 years ago. It's a data set for our patients so we can diagnose properly. And when we diagnose properly, we tell patients what's happening, and when they can heal, they end up trusting us a lot more. They understand that we're the place of care that they should come to. I hope the practice tip was helpful to you to understand that cone beam is not just for specialists. Cone beam is not just for those who are doing extensive implant therapy or those who are doing extensive endodontic therapy. I think it's for all dentists today from a standpoint that's allowing us to give patients truly comprehensive care and understand the diagnostic value of it.